Well, hello, good afternoon, everybody, and thank you so much for joining us. We probably wait just a minute or two, just because there's lots of people popping in now. So I'm just thinking it might be worth waiting another moment or two, and then we will get started. I noticed there was one question in there about the slides. Yes, we will be sharing the slides and a recording of this webinar after the webinar. So you will be able to share this with your colleagues. Okay, I think maybe now we should get started. So first of all, as the Charity Secretary and Trustee for PANS Pandas UK, I'd like to give everyone a warm welcome and thank you all for attending today's session on understanding the impact of PANS, pandas and long COVID in a school setting. We anticipate that the speakers will take between 35 and 45 minutes to make their presentations, at which time they'll be happy to answer any questions you may have. Please type your questions and who they're directed to in the Q&A box or the comments box, whichever you feel more comfortable using, as you think of them during the presentation, and we'll come to them at the end. So first of all, I'd like to start today's webinar with a very short video, just to give you a flavour of the kinds of symptoms that a child with PANS and pandas may experience.
Oh my God.
I would wash my hands to the leg.
Okay, so it is now my absolute pleasure to introduce today's presenters. So Dr. Indra Varathan is the owner and founder of a specialist functional medicine practice. Having previously worked as a GP in the NHS for 17 years, Dr. Indra will be offering an introduction into PANS and pandas and how the strange and seemingly disparate symptoms may present in children. Then Dr. Indra will hand over to Tina Coop, who is an experienced SEND teacher and education executive at PANS Pandas UK. Tina will be outlining why it is important that educators are aware of the symptoms of PANS and pandas and how we can best support these children in the classroom. Finally, Tina will then hand over to Sammy McFarland, founder of Long COVID Kids. Sammy will be speaking about long COVID in children, how schools can ensure they provide a safe space for all pupils, such as adequate ventilation to prevent all airborne transmission, and advice on identifying symptoms. Unfortunately, Sammy has been taken ill, so is unable to join us live today, but she has sent us a recording of her presentation, which we will show to you. And she has confirmed that she'll answer any questions you may have today via email after the webinar, unless she's able to attend the Q&A, which she may or may not be able to do. We will be emailing you a recording of today's presentation, along with some helpful resources. I think I saw a question asking if we can send PDF slides. I'm sure that's possible. But for now, it's my pleasure to hand over to our very first speaker, the lovely Dr. Indra.
Hi everyone, thank you for being here today, and thank you to PANS Pandas for asking me to speak today. So as Vicky said, I started a private functional medicine clinic 5 years ago and left the NHS about 3 years ago. Functional medicine looks to support patients by understanding why patients are getting symptoms. So we look to find out the root cause of symptoms. We use a combination of nutritional changes, lifestyle changes, supplements, and food to help bring the body back into balance and hopefully the patient well. Now, when I started seeing a few kids that had anxiety symptoms. And through that, I have been linked up with the Pans and Pandas charity. So our goal today is really to increase your awareness about a cluster of symptoms that you could be seeing and that are associated with the condition called Pans Pandas. So Pans Pandas is an acronym for Pediatric Acute Onset Neuropsychiatric Syndrome, and PANDAS is Pediatric Autoimmune Neuropsychiatric Disorder associated with strep infection. In essence, what is happening is that these kids are encountering an infection, such as a streptococcal infection, which you see in throat infections or chest infections. The body is creating an immune response to the streptococcus or the infection. It's creating antibodies in order to defend itself. And unfortunately, in these kids, or this is what we think is going on, is that these antibodies are actually reacting with certain parts of the brain. And when the brain becomes inflamed, that is what causes the variation in symptoms with each kid. So what are the symptoms that we are seeing? You can see here, there's a number of different symptoms. And the reason that these symptoms are expressing itself is really down to the fact that there are parts of the brain that are being affected, are linked with motor function, emotional function, and also behavioral function. Now, these symptoms are quite subtle sometimes, and sometimes quite bizarre. Now, the Pans Pandas charity recently did a survey to sort of ask about, from their followers, from their members, what kind of symptoms really presented in the kids. And the main symptoms that they found were anxiety. Now, as I said to you, the symptoms are very variable in kids. And some of the kids that I've looked after, the anxiety only really presented itself at home and not really at school. And what we find is that there is a very subtle shift in how the child behaves. Next symptom is OCD, or obsessive compulsive disorder. And this can be very variable. One of my kids that I look after, the main OCD is recurrent thoughts. And these recurrent thoughts can be very, very bizarre thoughts, to thoughts about wanting to harm themselves and thoughts about food that they eat, a number of different things. The third symptom that they found was emotional liability. And what happens in these kids is that they're at one point, they're absolutely fine. And it could be the very slightest of trigger, and then they completely change their mood and their personality. One of the kids that I was looking after, the next symptom of sleep issues started quite suddenly, it felt, to the parents. She was absolutely fine until she was 6 years old, and then started having problems with being able to sleep by herself. So the sleep issues can be very varied. It can be that they struggle to sleep by themselves, struggle to sleep through the night, or just have problems with tiredness and fatigue as a result of that. Aggression presents itself in a number of different ways, and rage is one of the words that my parents use. The kids are absolutely well, and then suddenly it comes out, and they're sometimes kicking and screaming and tearing the house down. Again, it's very variable in each child. And then the last symptom here is your tics. This is sort of an involuntary movement in the body, and we're seeing a lot of this recently as well. And people have said it's been linked to stress and things like that. So what you've seen in the video is that kids are very variable. Some of them present with very bizarre symptoms, and some of them present very, very subtly. In the child that I was looking after, she was absolutely fine in school, and school really didn't have a clue that there was anything going on until she came home. And when she was at home is when the problem started. And then as she got worse, she actually ended up with having problems with her eating. So you can see in this picture, another really key thing to know about PANS PANDAS is that each child presents itself very, very differently. As you can see in Lauren, she had OCD, insomnia, and enuresis, or bedwetting. Hamid has tics, anxiety, and emotional liability. And Bella has problems with eating disorders and behavior problems. And some of these kids actually have a problem where they regress in terms of their handwriting and also their behavior as well. And some of the more severe ones have hallucinations. What this kind of means is that it's really, really a challenging diagnosis to have. And even from a GP perspective, it is not really a very well-known condition. And often these kids get diagnosed with all sorts of other conditions. So these are some of the conditions that these kids get associated with: anorexia, food disorders, just OCD on its own, even conditions such as autoimmune diseases, autism, and also chronic fatigue. In the survey that the PANS PANDAS charity carried out recently, they found that even those that get the diagnosis of PANS PANDAS, there are a number of different terminology used for this condition. So there's suspected PANS PANDAS, post-infectious inflammatory neuropsychiatric disorder, or an immune-mediated neurobehavioral disorder. All in all, really saying the same thing, that there is an inflammation that has been triggered by some kind of stimulation to the immune system, and the brain being inflamed is causing a variety of symptoms. In that same survey, they found that actually the majority of kids don't have any other diagnosis, 59% of those that were asked in the survey. The other thing that we really want you to be aware of with these kids is that because it is quite a complex set of symptoms and there's a waxing waning set of symptoms that happen, it can take a long time for these kids to get diagnosed. And in the survey that they carried out recently, it took over 2 years for these kids to actually get a diagnosis. So that means that, we really are delaying the treatment and possible help and healing for these kids in order to get them better and move them forward. So what we really want you to be aware of is, if you have a child who you notice has a change in their behavior from being completely normal and to suddenly developing a little bit of anxiety, you notice that there's been an academic deterioration, severe anxiety, especially sort of separation anxiety in terms of leaving their parents, changes in their behavior in terms of being more aggressive. And the other thing is eating disorders, or a change in how they eat. One of the kids that I was looking after, she really struggled with other people eating around her. She couldn't stand the noise of her mum or people around her chewing. These are some of the other things that we see in schools as well, that for you to be aware of for the kids. So Tina, I'm going to now hand you over to Tina, who is going to tell you a little bit more about how to support these kids in school. Just before I finish, I just wanted to tell you a little bit. I asked one of my mums who I look after, is there anything that you really want the teachers to be aware of? And what she said is, we are dealing with a very bizarre set of behaviors. We're struggling with this at home, and we just want you to be aware that we're doing everything we can to bring the kids back into school. So please do be aware of it and support them as much as you can. Thank you very much. I hand you over to Tina now.
Hello, and thank you to Dr. Indra for that really informative talk about recognising and supporting children with PANS and PANDAS. And I'm going to talk to you a little bit about the education side and supporting these children in schools. So schools are, we feel, in a really important position to support these children. And these are some of the main symptoms or changes that we need to be aware of. New or recent onset is an interesting one, because often when we look back in a child, we can see the worst, smaller signs. However, there is then usually a more dramatic onset. And parents will perhaps come into school and say, my child's completely changed, I don't recognise them anymore. And if a parent's saying that to you, then it's perhaps important as educators that we listen. Some children as well regress in their learning, and that's another important sign, and we'll talk more about that in a little while. And some children suffer from really severe anxiety, and this can manifest itself at the school gates with the children screaming and crying and not wanting to be separated from the parents. And urinary problems tend to come at an early stage. So a child might start bedwetting or needing to go to the toilet more frequently. Okay, so red flags in school. So handwriting deterioration is quite a significant one. Some statistics suggest that up to 80 or 90% of children develop this. And we can see here some examples. Now on the left side is when a child was in a flare. You can see the letter formation is different. It's cursive on the right side, and also the spelling and the spacing of the letters. Fine motor control skills can also deteriorate, and this is quite a dramatic example of a child that's in a flare and when a child's in a period of more stability. And you can clearly see the different developmental age that's illustrated by this drawing. Sleep problems, these can be really severe. Problems falling asleep, staying asleep, new onset of night terrors, and obviously that has difficulties for parents to get their children to school the next day and for the children to concentrate. Sensory sensitivities can also appear for the first time. Often children become quite sensitive to sound. Some may even need ear defenders. A lot of children develop issues in working memory, and this can be quite severe, but it also will fluctuate from day to day. Some children lose their overview, forget days of the week, and quite basic skills. And again, this is likely to fluctuate. Although it's not part of the diagnostic criteria, 25% of children with these disorders suffer from hallucinations. These can be visual, so perhaps seeing quite scary images. They can be tactile. Often children say that they can feel bugs or insects crawling on them. Or they can be auditory. Sometimes children hear voices, and clearly if this is happening, children need evaluating by a medical practitioner, and it's very difficult to manage in a school setting. We know that 1 in 5 children with these conditions develops some form of eating disorder. It might be a fear of choking or vomiting. Some children feel that the food is contaminated, and it might take them increasing amounts of time to eat small amounts, and in severe cases this can lead to weight loss. And we know that children who develop these conditions can develop learning difficulties. This can include things like dyspraxia. Some children develop dyslexia. They can have problems with executive functioning, and all of these things are a change. And if you speak to parents, parents will talk about the aggressive behaviours as being some of the most difficult for them to manage. And not all children develop these, but some children with these conditions can become very aggressive, struggle with friendships, and this is usually more severe at home than at school, and that's something for schools to be aware of. So OCD is part of the diagnostic criteria for either PANS or PANDAS, so it's quite important. From a school's point of view, we need to be aware of how many different ways OCD can present. For example, asking for constant reassurance, or a child might have continual intrusive thoughts about harm coming to them, their pets, their loved ones. And there's quite a wide-ranging set of symptoms, and sometimes it's not being picked up in these children because we don't know what to look for. A big clue about OCD in the context of these conditions is that it also arises with other symptoms such as the academic regression, changes in behaviour, and also OCD in PANS and PANDAS tends to be quite dramatic. It comes on abruptly, and you can have dramatic exacerbations and then it calms down, whereas with more traditional OCD it tends to come on a bit later, around adolescence, and to have a more gradual onset. And the other part of OCD, the compulsions. Again, there might be some of these that we're not really recognising in school. For example, if a child suddenly starts rubbing out in their schoolwork all the time, and we know that mental compulsions are often occurring in children and we can't see those. So it's really important to have also a medical practitioner involved in these children, and also in terms of how the OCD should be supported in a school setting. So we've got lots of statistics, but this one, for example, suggests that up to 60% of affected children will develop special educational needs. Now, we don't know whether these children had needs before. We clearly need to be doing a lot more research with this subset of children. And on this slide alone, I'd really like to point out the second one, because ensuring that the child has a person or team and a safe space to go to when they are struggling, I think is really important and really key for these children, particularly in high school where they might be moving from class to class. And it's important that that team know the child's narrative so that they don't need to keep explaining themselves over and over. So again, the amount and quality of work that a child will produce will be really different. It may be different day to day. They may have slept badly. They may be struggling with brain fog, intrusive thoughts. They might be hallucinating. They might be severely anxious to even get into school. They might be struggling to write. And yet during periods of greater stability, the child may well be able to access a much higher level of work. And we need to remember that as well. And be supportive in schools. So we know that a lot of these children aren't being picked up or recognised. We know there's current issues with diagnosis, and that's where schools can really play a crucial role. If schools conduct a baseline as soon as the condition is kind of suspected, that will be really helpful. And schools can then also help by monitoring whether the children are returning to their baseline between exacerbations, and whether specific skills or difficulties are becoming chronic, or whether they are then completely returning to how they were before onset of these conditions. And we know that when children are not diagnosed and treated early, that some of them start to develop chronic issues. These are some good questions. I'll just give you a second to read through those. So I just would like to draw your attention to the issue of attendance and PANS and PANDAS. We know that these conditions have a substantial impact on attendance. There are children, I think it's 19% of children in a recent survey by PANS UK that have missed more than a year in school. And we know that there are several children missing many months. We need to be kind of asking ourselves whether the child is well enough to be in school sometimes, we need to be considering symptoms such as anxiety within the context of them being immune mediated, and we really do need a collaborative approach in order to support and facilitate these children. And on the last one on this list, parents know their child best. We know from the group that many parents feel frustration. Their child may be masking in school. It's highly likely that whatever you're seeing at school is much more severe at home. And also sometimes children have moved setting, and the current setting did not know the child before onset. So if that's happened and a parent is saying my child has changed, please document the holistic changes and consult with their previous setting. I love this. I think this is the approach that we should use for these children. Collaboration should be between medical professionals, educators, families, and with the child's voice right at the centre of that. The second one is compassion. We know that these conditions haven't really been recognised, and that families are really struggling to get their children diagnosed and treated. And it would be fantastic if schools and educators responded to that compassionately. And we know that there's a lot of flexibility needed. There's flexibility needed in terms of managing the symptoms, in terms of how much support the children require. There's flexibility needed in terms of us asking ourselves as educators what the best approach is for these symptoms. Is it traditional approaches towards dyslexia or dyspraxia, or should we be thinking about alternatives? I'll just give you a second because there's quite a lot on this slide. So we know that when a child changes, it's the psychiatric symptoms that tend to be the most focused on. It's because they're the most dramatic. If a child has developed severe anxiety or is even hallucinating, those are going to be the symptoms that are focused on. And some of the less obvious or less dramatic symptoms, such as, for example, issues with executive functioning or deterioration of fine motor control, they're being missed. But it's really important that we holistically assess these children and look at all of their changes. And children may well regress from their individual baseline, and sometimes parents have hit a bit of a brick wall in terms of saying their child needs help because schools have said, well, you know, they're okay, but actually the children should be assessed on their pre-onset cognitive baseline. That's important for the individual child. And we haven't really done enough research on how the experience must be for the children. I can only begin to imagine how it must feel to have developed all of those symptoms and to be managing the multiple demands of school life. And children are highly likely to require significant nurturing support. And I would say this is during an exacerbation, but also following an exacerbation in terms of them coming to terms with what they've been through. So I'll just give you a second. I really like the fourth one. Be especially aware and curious if you did not know the child to onset. I think that's really important. So we know that in severe or chronic cases, we know from the group that there's some children, they're not accessing any kind of formal education anymore. Or they've got highly bespoke packages of education. And we need to kind of think about settings as well. When these children are being placed in settings, are they being placed in them when they're in a flare and it's all on that? Or are they being placed in them when they're in a better period? And we need to also build in the facilitation to help these children recover. Siblings as well, this is an area with which they also require support. They are witness to their brother or sister going through multiple changes. Obviously the distress in the family, often one of the parents needs to leave work, so that's a change in the economic situation. And yeah, so it's fantastic if they all work together collaboratively. And we need to be aware that many children recognise that they're really struggling to manage things that used to be really easy for them, and that must be very difficult. So who are the charity? They were formed by a determined group of parents, I think in 2018, and they were determined to ensure better diagnosis and effective treatment for these children. And I've just got some references and Twitter address here, but I just wanted to also let you know that on their webpage, if you go to resources for educators, there are now some resources for teachers, for parents, and there's also a poster for schools to raise awareness of these conditions. Okay, it's a little bit more. Okay, so I'm going to introduce now Sammy, and she was the founder of Long COVID, and she's prepared a presentation for you about the implications of long COVID and children in schools.
I would like to tell you a story about a group of ordinary children living ordinary lives. Many months ago, we all became ill with coronavirus, and very soon we became very ill. Some of us became seriously ill and had to stay in hospital. Our symptoms looked a bit different to the ones that grown-ups seemed to get, so our parents didn't always know what was wrong with us straight away. Coronavirus doesn't only affect children like us. Many of our parents got ill too. So we've all stayed home and tried to look after each other. But many of us got worse and needed extra help from doctors. Our parents were often scared. It seems like a long time ago that we felt well and could do some of the fun things we like to do. We're still at home and we're still unwell. Many of us are still in bed a lot of the time. It can be boring, annoying, frustrating and tiring, and we miss our friends. We miss feeling well. One day, a group of doctors and grown-ups, who are all ill just like us, called our really long illness Long COVID. Long COVID means that you're still ill after many months, and you never know how you'll feel when you wake up or try to play your favourite games. One day you might feel okay, and the next you might feel terrible again. Sometimes you might feel okay and terrible on the same day. It's very confusing. Having long COVID is weird because it didn't even exist last year, and we're the first people to have lots of different things wrong with us. Pain, exhaustion, brain fog, tummy aches, headaches, aching arms, feeling faint, falling over, bubbles in skin rashes, tight breathing difficulties, loss of appetite, chest pain, fast heart rate, stuttering, nosebleeds, seizures, organ damage. We didn't feel like this before we got coronavirus. We felt like you. Now we all have long COVID and nobody knows what to do. Our parents are working together to get us some help, and that's why we're telling you our story. We want to feel better again, and when we ask when will we feel better, nobody can tell us when that might be. It's making us sad. So now you know nearly as much as we do about long COVID. We hope it helps, because we don't want you to have to feel like us. Please remember, kids do get coronavirus and can pass it on like grown-ups can.
Hi, I'm Sammy McFarland. I'm the founder of Long COVID Kids. I'm going to take you through a rapid tour of our school awareness pack and hover over some of the slides which I think are going to be most interesting to you for this presentation. But I did want you to see everything in the pack because I'm hoping that you're all going to go away and download from our website and have a good read at a later date. So let's just have a quick look at the prevalence of long COVID in children. There are 74,126 children in England alone with long COVID at 5 weeks after COVID infection. And the new ONS data has just come out and tells us that there are 45,616 children presenting with long COVID still at 12 weeks. And for many reasons, we believe that figure will be a lot higher. And also, please just remember, this is England alone. So let's just look over to the right-hand side of the tile there in the blue, and it tells you that there are 5,433 children that have been hospitalized with COVID infection. And this is the figure that you will often hear being referred to when they say not many children are affected by COVID. So if we just look at the figures in the orange and the figures in the blue, you can see why long COVID really is a much more sizable problem than everybody wants to let on. And I just think that this is such an important point, because these children are having significant changes that are going to need to be managed in an educational setting. So our group is an advocacy and support group. We started in October. We have 2,600 odd children now, and we welcome about 100 new members each week. We work with a number of different partners, including the WHO, the NHS, National Institute of Health and Research, as well as some local groups as well. Our pack includes a letter to head teachers and a letter from a teacher with long COVID. And I really do urge you to read that, because I think it really sets out her experience of long COVID, and one that we hear from many teachers in the teachers long COVID group. So our mission statement is very simple: to raise awareness, to support the medical community, and to aid and facilitate the implementation of providing safe spaces in the pandemic to protect children and staff from the risk of long-term chronic health. Bottom line, we don't want you to have to share our story. We don't want anyone else to have to share our story. So if we can help prevent that, then we will. So let's just look at the barriers around testing children. And this is an important slide to me, because it really highlights why we think there are going to be a lot more children in the community with long COVID than have yet been identified. So I'm going to just whiz through this quickly, just to say that there's never been a clear government campaign that helps parents and carers identify COVID-19 in children. So many cases will have not been identified, tested, or recorded. Research shows that children do not always show the common symptoms which qualify them to be tested. The government website doesn't have family-friendly questions on the testing website, so that actually precludes children accessing a test. They ask about adult symptoms, and many young children don't get tested because the swab doesn't fit up their nose, so perhaps they get an inconclusive test, or the parent decides not to test them because of the stress of the situation. And finally, families tell us that where they have more than one child that's ill, they'll often swab either just one child or just one area of their children to reduce the stress and hassle of testing. And then they maybe make an assumption about the diagnosis of the other siblings. And of course, none of those children will have been recorded. And this is also a problem, because later on, if you haven't got that PCR test, it can be quite hard to get the correct diagnosis, which then opens the door to accessing some of the care services that are being put in place. So we really do think it's important that children are tested, that the data is recorded accurately, not just so that we've got this picture of what's actually happening, but also so that families can access the care that they may need at a later date. Let's think about what is COVID in a child. So children present less often with respiratory symptoms. They often suffer with headaches, fatigue, and skin rashes. And this picture is actually this poster we've made. It's based on the symptoms that the families in our groups tell us that their children presented with. And actually more recently, the COVID Zoe app have started talking about some of these symptoms as well. And I've put those onto the left of the page in the bigger group. And the ones on the right to the page, the higher up ones, they're the ones that I don't believe other people are talking about so much, but that our families report to us as being the symptoms that they noticed in their children. And certainly we think that they need much more, they need flagging up and they need highlighting. And if you're seeing children with dizziness, fatigue, chest pain, mood changes, then you need to be thinking COVID, and those children need to be getting a test.
There's a little bit of information about long COVID in adults in our pack, and then we go on to talk about long COVID symptoms in children. So this picture, this poster which we've made, which we very much hope you'll pin up in your staff room, really shows you the symptoms that children are reporting. And these are the top 10 symptoms that we found in our survey. And it's gastrointestinal issues are number 1, round to chest pain at number 2, headaches, fatigue, joint pain, sore throat, rashes, dizziness, mood changes, and nausea. And these are symptoms that may come and go. They're relapsing and remitting. They may come on their own, or they may come in clusters. I think it's really key here to highlight that many children have a period of what we're terming as an apparent recovery between infection and long COVID symptoms. And it might not be that they seem completely well, but they can often start to see a return in energy, start to become less symptomatic from their original COVID symptoms. And that's the time where we would be saying, please urge the child, the family, to be cautious about the amount of activity the child is doing, because it's commonly reported that the children fatigue early or easily, more easily than they did before they had COVID. And we would say that's a red flag. That's a sign that those children are doing too much and they need to just ease off the gas a little bit and take a little bit more rest. And it's something that the families that were infected right back in the beginning of March last year, that around that time, we wish now that we'd had that information, and we wonder whether our outcome might have looked a bit different if we'd had that information. So I'm just going to play you a video that we made to mark the 1-year anniversary of children getting sick in the pandemic. So you can just get a little bit of an idea of what it's been like for families to live with long COVID over the last 12 months. And while that plays, I'm going to hopefully give you a summary of long COVID in children. So we know that children can be asymptomatic, atypical, or symptomatic with their COVID infection. We know that the level of infection that they get does not reflect on the type of recovery that they have, or doesn't appear to at this point in time. We know that each child can present very differently with long COVID, and that many children have a period of apparent wellness between COVID infection and their long COVID symptoms. Symptoms are wide-ranging and systemic in nature. The most common symptoms are fatigue, headache, stomach pain, dizziness, and muscle pain, with the most frightening symptoms paralysis, electric shocks to the eyes and head, nerve pain, testicular pain, liver damage, and new onset seizures. Among the symptoms are many neuropsychiatric features, including anxiety, OCD, and extremely volatile mood changes, which may be associated with the neuroinflammatory processes, as well as the natural response to being so unwell. The problem is we just don't know yet, so we need to be more curious about long COVID. We need to be sympathetic to the families managing long COVID. As an organisation, we're working hard at raising awareness for the need of a phased return to school policy for children with long COVID. And we're also working on creating a support document ourselves. I hope that's giving you a little bit more information about long COVID in children. I'll be really pleased to answer any questions you have. Please give them to the team and I'll either address them via email or in the Q&A at the end today.
Okay, well, following that very sobering video, I just want to say thank you very much to all of our presenters, and thank you for taking the time to attend this presentation. I also want to apologise because it appears the quality of the slides from the long COVID kids wasn't readable. We will ensure that those are sent out to you, and I think somebody did mention in the chat actually that they you can just download them directly from their website if you want them more speedily. But just to say, we strongly believe schools play a very, very important role in supporting these children. So we're really grateful to you for your participation in this webinar. And so now Dr. Indra, Tina and myself are going to take a look at your questions, because I've seen quite a few of those popping in. And we will try and get through as many of them as we can in the time we have left. We will be closing at 12, so that gives us exactly 15 minutes. So I think, Indra, you're going to take a look at those questions and divvy them out.
Yeah, so there was a comment really from somebody saying that interesting that the symptoms could be easily confused with signs and symptoms indicating abuse. And that was something that I was supposed to mention in my presentation, is that a lot of these kids do end up being referred on to social services or having social input because of the bizarre nature of their symptoms coming on and how they change in their behavior. Definitely is something that does cross-pollinate between pandas and safeguarding issues as well. And this, as you can see, the symptoms are so varied, so different, so variable. It's a really difficult way to diagnose things. Tina, did you want to add anything to that?
No, you've said it really, but it is really difficult because obviously it's very important, schools' responsibility for safeguarding. And we do know that many of the symptoms are red flags that we learn about in school. And we do know that some families have been investigated for these safeguarding concerns. So I guess as an overarching, it's important to be aware of the conditions and how they can present alongside being thoroughly informed about safeguarding responsibilities.
So there was one question about what diagnostic methods were there for pandas other than a anti-strep blood test. And actually that comes on to something that I wanted to talk about if it didn't get brought up, is that the diagnosis is quite difficult. We haven't got enough diagnostic tests. We can't do a test and go, yes, definitely this is PANS or pandas. And we had a presentation yesterday from the team at Molecular Labs talking about the Cunningham panel, looking at autoimmune or on antibodies that are affecting the brain, which gives us an indication that there is something that is affecting the brain in itself. So at the moment, the diagnostic criteria is very clinical in the presentation, the types of symptoms that they're having. And as a functional medicine practitioner, what we're looking for is, yes, tick, make sure that the strep is not there, or the whatever, what is the actual trigger for the immune system. Then we start looking at all sorts of different kinds of infections. And there are a vast number of infections that's been associated with PANS. And then we look at other things that have triggered the immune system, such as allergies, food intolerances, and all of these things. And the e-hospital has a diagnostic criteria that looks at even celiac disease is part of the things that can cause brain inflammation as well. So it isn't a very straightforward thing. And I think that's what makes it really tricky in diagnosing it. We have another question. My 2 children have PANS as a result of long COVID diagnosed by a neurologist. It's an important link as many children are now displaying these neurological symptoms in the long COVID group. Yeah. Definitely. Let's have a look. Are these children contagious during long COVID? Now that's an interesting question, and I think there's still a lot of work going on. But as far as I understand, there isn't active infection going on. This is patients that have got over the main infection and now are experiencing the result of their immune system either still being overstimulated or trying to deal with the remnants of the infection in itself. Can we watch the webinar following the presentation? Yes, you can. It will be available, isn't it, Vicky? Will you be sending it out to everybody?
We will. We'll be sending out the recording, plus we will be sending out the PDF slides of all of the slides you've seen today, so that hopefully you'll be able to read them more clearly.
Yeah. What would be your top therapeutic tips for those supporting young people with these difficulties? So from a medical perspective, the top therapeutic tips would be to understand what's triggering the inflammation. And there's a whole host of things that could be triggering the inflammation, and finding ways to reduce that inflammation. From the treatment modalities that are available at the moment, we're looking at things such as antibiotics, which help to basically get rid of the infection that's stimulating the actual immune system. Ibuprofen or some kind of anti-inflammatory has been used. In America, there are things such as IVIG, which is a immunoglobulin treatment, and also some kind of antidepressant or antipsychotic type medication, depending on the presentation. So as you can see, because it affects so many different parts of the child, what Tina said about having a multidisciplinary approach is the only way to treat these kids, because generally speaking, because if the GP doesn't know who it is or what's going on, they go down certain pathways and end up with certain diagnoses. I'm doing a lot of the talking here, but in terms of medication support, PANDAS children, I've heard antibiotics is offered. How effective is this in helping a flare? So that is again, a very interesting question, and it is very, very personalized approach to the kids. Some kids, antibiotics is what they need, completely takes down their flare, and they seem to return back to normal. And some of the parents say it's like magic. They seem to heal with it. Some of the kids that I've been looking after, antibiotics helps, but doesn't fully help. So we just need so much more research to understand exactly what's underneath each of these children. And the more and more I work within the functional medicine field, the more I realize, we're all so unique. We have so many different aspects that lead us to our story and where we are at the moment. And, and our genetics is part of how we respond to the world around us.
Can I just interrupt and say that actually the charity did a questionnaire, a survey of about 700 of its members who all have children with the conditions, and the antibiotics and anti-inflammatories were the most effective medication in their opinion, and in some cases we do see children change within days of starting antibiotics. It doesn't work for everybody, and I think much of it depends on how long the child has been ill. If a child is found, if the condition is diagnosed very quickly within a week or a few weeks, then the treatment can be, absolutely cure the condition. But that is a very, very rare thing, because in most cases, the child will present to the GP with, some kind of behavioural change, because as Tina and Indra both said, very often these children, it's the one symptom that's the most difficult to manage that stands out, and all of the other symptoms are ignored, and very often that can appear to be behavioural. So the parents will either be sent off to parenting classes, or the child will be referred to CAMHS, and there will be a long wait before any kind of treatment is given, and that is what can make it much more difficult to treat. Definitely. Sorry, carry on.
No. Do you look at Lyme disease and Bartonella as triggers? Yes, I would. And I'm just trying to think of my conventional colleagues. I think there is more of an understanding that there are other triggers as well, but I'm not sure necessarily Lyme and Bartonella is considered. Would that be what your experience is, Vicky?
Yeah, in my experience, generally, a traditional doctor, an NHS doctor, won't consider Lyme or Bartonella or any of those, tick-borne infections at all, unless somebody has a very, very sort of acute onset. If they've got the bullseye rash and they've got evidence that they've had a tick, and even then it's a couple of weeks of antibiotics and then they're fine, and they don't really consider the chronic Lyme that so many people suffer with. So yeah, it's all kind of mixed up in the same sort of bag, really.
There's a question here: are there any treatments that parents could start to do at home whilst waiting for a diagnosis? Now, that's quite a tricky thing for me to say as a doctor, because it's very important to really understand what is actually going on with the child, because it could be a load, so many other things as well. So I think now that people are more aware, and we are definitely going to be trying to increase the awareness in GPs as well, hopefully there will be things such as the antibiotics and maybe some ibuprofen and things which we do prescribe for kids anyway, that could be used while further referrals are being sought after.
Mhm.
There's a long history of children being misunderstood, conditions being accused of abuse, and being mistreated by medical professionals. Schools should really help with this. There's a lot of information about this in the ME, CMF, and chronic Lyme communities. So do please reach out for support if you need it. Thank you. We will, definitely. Is it worthwhile or even possible to get a diagnosis of long COVID in children after the symptoms have improved? I think that might be something that we could take to Sammy. I guess in terms of me being a medical doctor, it's kind of, yes, knowing that they've had it and knowing that they have a susceptibility to immune stimulation and immune system effect, it would be a good idea to know that if and when they come across other kind of infections in the future as well.
Can I just pull out a question? Somebody here has asked, when a parent says their child has mild PANDAS, is this possible? And also, do antibiotics help? A child in my class has been on them for ages. Can I just say that, yes, it is possible to have mild PANDAS. There you can have mild, moderate, severe. It is like a spectrum, and you can have a real range of symptoms. Some people can manage very well with almost no treatment or with, occasional treatments. Some children need to stay on antibiotics for a very, very long time. There are some who I know of whose children have been on them for 4 or 5 years so far. And it doesn't cure the condition, but it keeps the symptoms under control. And then when they try and come off the antibiotics, the symptoms flare up again. So yeah, many children are on them for a long time. I hope that answers that question.
We've got loads of questions here. We've only got 3 minutes left. So I think what we might need to do is to take these questions and then maybe answer them and send out some answers to people. Would that be okay,
Yes,
Vicky?
Yeah.
Absolutely, we'll do that. We'll make sure that any questions that are targeted towards Sammy, that we'll get her responses. We'll also respond to all of the other questions, and then we'll go from there. I do want to respond to just another question, which says, can you have just 1 or 2 symptoms? And what I want to do is just very, very briefly before we close is run through the diagnostic criteria. And I will send this out to you as well along with your email. Because for a diagnosis of PANDAS, you need only have tics or OCD. That's all. You will often see lots and lots of the other symptoms, the anxiety, the behavioural regression, the emotional lability, all of those things. You may see those as well, but they don't always happen. And in fact, you can just have tics, or you can just have OCD. And by tics, I mean involuntary movements and involuntary sounds. So they can be, words that are said or sounds that are made, as well as, physical bodily tics. So that's PANDAS, and that's quite a simple diagnosis. With PANS, PANS is either an eating restriction of some sort or OCD. You don't have to have tics, and you must have, along with the eating restriction or the OCD, you must have 2 of the other symptoms, and these I will send out to you, but they include the anxiety, particularly separation anxiety, the sleeping issues, the enuresis or the bedwetting or urinary frequency, the behavioural regression, the sensory overload, all of these other symptoms which can seem quite vague, but they're usually quite severe. And so PANS is much more complex to diagnose than PANDAS. But yeah, some people have every symptom on the list and they tick them off, other people will only have 1 or 2 of those symptoms. So it is very varied. And as Indra said, for a doctor, it is a real challenge to diagnose these conditions. So you know, we know that it's not an easy answer. Okay, so I think with that, I'm going to draw this meeting to a close. Thank you so much, everyone, for your fantastic questions. And there are so many more. They're piling in. So we will get them answered and we will get them out to you. Please contact the charity. We're at panspandasuk.org if you have any questions after this, and we will endeavour to answer them for you. So just as a recap, the purpose of holding this short webinar was to offer educators like yourselves simple advice in recognising and managing those suffering with these conditions, including supporting the children and the families to achieve the most positive outcomes that they can in school. We also want to draw your attention to our next more in-depth teacher training. It's currently undergoing CPD accreditation, but if you're interested in attending the training, please visit the panspandasuk.org website, go to the educators page, and you will be able to sign up, or, you know, your interest at least there. And then I would just like to thank our guest speaker, Dr. Indra, and Sammy McFarland, as well as our very own Tina Coop. Special thanks also to AONM for providing the technical and planning assistance with the webinar. And also, she's very, very quiet and she's hidden away in the background so you can't see her. But I want to thank Tony Whitney, our media executive, for putting this whole webinar together. Thank you very much indeed. And I'm just going to close with, I'm going to share my screen and let you have contact details as well. And if I can find it, here we are. So we'll leave that on for a little while so you can contact us easily. But thank you very much, everybody, and goodbye.